A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, welcome. How lovely to see you. Thank you so much for joining us. And I'm so happy to welcome Shrikant Talari. Dr. Shrikant, how are you?
I'm good, Mary. Thank you for having me.
It's lovely to see you again. And you have brought with you a whole lot of information about your work with cancer.
Yeah.
Tell me what's happening.
So I think, Mary, when we spoke last time, when we did this podcast last time, we talked about how, homeopathy can help people nullify their causative factors.
Yeah.
And essentially, those causative factors were lifestyle factors, like if someone is smoking a lot, or someone has a bad eating habit, or too much stress. These are what in homeopathic language we call as lifestyle causes. So these lifestyle causes, how we will address, we learned. But recently I understood the importance of integrating these lifestyle causes with genetic causes, and that has increased my result percentage even more.
It's
So I thought
amazing, isn't
I
it?
would like to share that.
Okay, that's fantastic, because we're just talking more and more about inherited susceptibility and that genetic cause. So this really fits in well with a lot of talk that we're hearing about. So just remind me, Dr. Shrikant, you work in a hospital in India, is that correct? Yeah.
Yeah, yeah.
And so you're seeing
Not a hospital, but it's a OPD setup. But I can admit patients. I do admit some of my patients in hospital, especially last stage cases. In India, I am allowed to do that.
Okay.
And Mm.
And I understand you have quite a big client base, and you're seeing cancer patients a lot of the time at all stages. Is that correct?
Correct. I see cancer patients daily, every day, at
Okay.
least one or two I see.
Okay. All right. So tell us a little bit more about the genetics and the genetic factor of cancer.
Yes. So I think a lot of cancers today are happening um, because of genetic factors. 15, 20 years back, when it started, a sort of epidemic started, it was mainly because of lifestyle factors, no? But now it's becoming more and more common, and that's why we see so many preventive surgeries happening. No, my mother had, so I will also get my breast out. No,
Yeah.
my father had, so I want to always check my colon, so on and so forth. All this is happening, and people keep asking, can't you do something so that I don't develop? What is the short way of doing it? No, many people come for prevention, and um, mm, usually, Mary, what I used to do is I used to take the history and find a remedy which matches the mental symptoms, the physical symptoms, and give it. And I was under the impression, if the background is clear, the genetic will also clear up. But there was one interesting case after which, my eyes really opened up. Hmm. So this was a woman who had sigmoid colon cancer. She has this cancer was first diagnosed in 2021. That time she underwent surgery, took chemotherapy. After 2 years, it came back. In 2023, it came back. She again did surgery, chemotherapy. In 2024, it came back. This time it was very widespread, so they had to remove a large part of her intestine, and she was very weak, and nothing was working. That's when she came to me. When I took the history, what I found out is that she always had gastric issues all her life for the last 20, 30 years, acidity complaints. And this acidity was because she used to eat a lot of chilies.
Okay.
He was very used to eating chilies and all this. But she really craved for chilies. So what she used to do, she used to eat chilies, she used to have this acidity, burning, etc. But then she would take an antacid, go to sleep,
Yeah.
managed.
Okay.
15, 20 years she managed like this. Hmm? So mm, when she eats these spices, then she would have sort of vomiting, loose motions, and very severe pain in abdomen. And if she passed stools, or if she vomited, this pain used to relieve. It used to get better. At present, also she has the same pain, burning pain in stomach, and there is continuous vomiting, stools, so she does not cannot pass. So the intensity of vomit is too much. She can't eat anything. Whatever she eats, even if she drinks water, she's vomiting. Okay. So initially what I did, I understood that the main, you know, lifestyle factor because of which she developed this disease is that she has not been able to overcome her strong desire to eat spices or chilies. If she did not eat that, she would not have acidity. If she did not have acidity, she would not have taken antacid. If no antacid, no acid, it would not have progressed into such a severe disease like cancer. So the for us the main causative factor was this spices desire for.
Mm-hmm.
I gave a remedy based on spices desire and also burning pain in abdomen, which was better by warm drinks. And the remedy that came up was arsenic. I gave arsenic. But after 1 week, she said, I have no relief at all. I was surprised because, I thought causative factor fits characteristic. This is very characteristic of arsenic. No burning pain better by heat. I thought, and arsenic is known for cancer. So I thought pathology fits, characteristic fits, causative factor fits. It should work. Mental symptoms she did not have so much. She was a farmer, very simple woman. She didn't have any anxiety nor any other mental symptoms. So then I started searching what happened, what happened. That is when I started taking more and more symptoms, and then she told me that since my childhood I have one symptom, that is I cannot tolerate buttermilk.
Okay. So that's quite different.
I said, buttermilk, why? What happens? She says, buttermilk, if I take, I will have the same acidity. Now, this is strange, no? Because generally, at least in India, I don't know in your part of the world, in India, they will tell that you drink buttermilk so that you don't have acidity.
Mm-hmm.
It will cool your stomach down. In fact, after spices also, it's tradition here to drink buttermilk so that you have less acidity because it has certain fermented
Yes.
bacteria which will uh, digest it. So then I said, this is very strange. Then I looked at buttermilk and there were only 3 remedies in it. Okay. One of the remedy was bryonia. And then I put some more symptoms and I gave her bryonia, after which she did very well. Her vomiting stopped, her pain reduced. She did pretty well on the remedy bryonia. Then I started to think, why was buttermilk more important than spices? No? Why is it so? Then I understood that buttermilk was a genetic symptom. This she had right from her childhood, and there is no external factor for buttermilk aggravation. And it was not a craving. She had aggravation from buttermilk. No, craving was a lifestyle factor that I like this, and it's something that you can control. You can still, you have some, you know, voluntary wish in it to control it. But buttermilk was aggravation, buttermilk was a completely involuntary symptom which was there right from her birth. So that moment I realized that finding such genetic symptoms which are inherent to the human being, which do not seem to have triggered from some lifestyle factor, is more important to actually, you know, get rid of the genetic tendency.
That's that's a really important fact, isn't it? But can I just ask, was there any history of food with her family history, with her parents or grandparents? Did they have any food issues at all?
To be frank, Mary, in this case, I did not ask. Okay. But what happened is, from this case, I started to learn that you have to ask the inherent symptoms. So whenever I'm asking for craving, aggravation, I'm asking for, are there any symptoms which you have, which you seem to have from your, birth, and which seems to run in your family.
Yeah.
And that I am finding out, a lot of symptoms are being found out. And in the last 1.5 years, since 2024 to this is almost, we are finishing 2025, I am having lot of patients who what is happening is, I can see the Herring's law of cure taking place, where if I'm prescribing remedies based on these genetic symptoms, then I can see that, for example, I had a case of breast cancer, and this patient also had a genetic disease which was porphyria. So porphyria is certain element is absent, because of which the patient cannot produce enough hemoglobin. So they have always very less hemoglobin. So I treated her breast cancer with a remedy. She did well. And then after this case, I said, I'm not happy with she only feeling better. I want to make sure that she does not have relapse of cancer. So I started searching genetic symptoms. That's when I found out that she had one shoulder pain on the right shoulder. And then I took history. Then I found out the remedy was chelidonium. I gave chelidonium. Interestingly, what I found out is, in porphyria, that element which is missing is missing because it's a element which is produced by the liver.
Okay.
And chelidonium is a liver remedy.
Yeah, that's right.
I gave that remedy. What was most amazing is, all her life, her allopaths told her that porphyria nobody can treat. You have to live with this. Her hemoglobin level was always around 7. From 7, it has jumped to 15, which is normal.
Okay.
That genetic transformation, when it happens, when a genetic disease gets better, then you know for sure that all other genetic diseases will also be prevented, including cancer.
Okay. So the relationship between the hemoglobin levels and her breast cancer were related, or just adding up to the overall health.
Yeah. So her breast cancer developed because she had a lot of emotional stress. Her father had fallen ill, her mother had fallen ill, she was taking care,
Okay.
and that really drained out. And then she developed breast cancer.
Okay.
Okay. I gave remedy, this anxiety reduced. So the difference is previously I would say, okay, my job is done, more or less patient is better.
Yeah.
No,
Yeah.
but now I understood that I can't stop here. I have to find that genetic trait and I have to treat this porphyria also.
Okay.
So that the genetic tendency because of which she can develop, because there was family history of uh, uh, um, breast cancer in her family. So if I have to remove the genetic tendency, then
Yeah.
I have to remove the genetic disease.
I understand. So it's going back and addressing that weakness, but the symptoms and the key to this was actually in the other diseases that she was holding all the way through her life.
Yes. That's why we say that was what is creating susceptibility for disease to happen.
Absolutely.
The-
Okay. And just for clarity, can you just explain again about Herring's law? Because we mentioned that the way of healing.
Yeah. So continuing on this same case of porphyria. Okay. So patient came to us with breast cancer. Okay. We treated breast cancer, but you saw in the background there was porphyria. Now you treated porphyria. Now she's complaining of new symptoms. What are her new symptoms? She says, I have globus hystericus. I have become extremely sensitive to people commenting on me, criticizing on me, etc. So I ask, where did this criticism? Why are you become so sensitive? Then she says, in my childhood, no, my father used to criticize me a lot. He used to tell I have to perform like this, I have to be like this, etc., etc. That fear is now coming back. So now I am treating that particular symptom. So this is what is Herring's law. In Herring's law, there are two, three factors that we look at. First, the disease will disappear in this order. First point is from within outwards.
Yeah.
Disease has to disappear from within outwards, from above downwards, and in the reverse order of its appearance. These are the three important factors.
Yeah.
So, when you give the correct remedy, what should happen is internal disease within outwards was first point. So, internal disease should get better and then external disease, which means suppose patient comes to us with skin complaint and with liver complaint, then first the liver complaint should improve and then the skin complaint should improve, because what is within is liver, what is outside is skin. Second point is above downwards. So suppose this patient has skin eruption all over the body, then first the face eruptions should reduce, then the stomach, and then the lower extremities. This is above downwards. And third is reverse order of appearance. So in this case, breast cancer was the last disease. So the first to disappear will be breast. If you treat that, then porphyria will start expressing symptom. If you treat porphyria, then the childhood symptoms will start coming up. If you see this reversal of the disease, that is what is Herring's guide law of cure, which says the actual patient should start developing deeper layers of diseases that are hidden inside. Those should start coming out and you should start treating those inner deeper diseases.
Just keep okay. So this really is a handy way of explaining, because often we talk about taking the layers of the onion and we take off what's where the energy is now and we address that, but then we've got layers underneath and people say, well, how long is this going to take? And you think, well, how far do you want to go? Because if we want to return you to health, we keep going, don't we? We keep going. And quite often we would see a return of old symptoms. And so what you're saying is, according to Herring's law, then we take off that top layer, we are going to see the layer underneath, and that's going to become much more apparent.
Yes. And like you asked, Mary, the question you had asked in between was, do you see the same symptoms in the family?
Yeah.
That's what we are trying to trace. We are trying to trace the disease which has began in you from generations, not just your father, your grandfather, your grandmother. Who knows where it all started? All that will start coming up if we go deeper and deeper and deeper.
And so that really makes sense, that actually what we're doing is we're looking at you where your health is now and what's expressing now. But as we clear that, we're able to go deeper. We're able to start building your resilience effectively and those weaknesses that you've been born with by just going deeper, by addressing that cause and in addressing those genetic inherited weaknesses.
Yeah.
Perfect. Okay, so we can actually open this right up much further then than cancer, can't we? Because this is almost all
Applicable
types
to
of
all
health.
chronic diseases.
Yeah. Okay. But it's just amazing to see, isn't it? Do you want to share another case that you have seen just recently?
Another case that I have seen recently. Cancer case or any case, cancer is better, no?
Yes,
Cancer is
I don't
better.
mind. Whatever.
Whatever. Okay. So recently I saw a case of pancreatic. This gentleman, he's a carpenter, he developed a tumor in his pancreas. So I am asking him symptoms of pancreas, what is happening, what is the pain. So he's saying, I don't know any reason. It will come anytime. I don't understand why it comes. Sometimes I feel it is because of this food, so I avoid, but still it will come. Sometimes I will eat that food, still I will not have complaints. Sometimes I will. Sometimes I feel it is weather, but nothing seems to be consistent. So I ask, how did all this start? That also I don't know. So then I said, okay, what other complaints do you have? He says that in my childhood I had mononucleosis. So in mononucleosis, primarily, uh, what happens is they develop this mouth infection and ulcerations in mouth after especially any kind of sexual contact. So he developed it immediately after a sexual contact, and since then he is having this mouth ulcers. And then I ask him what is the cause of this mouth ulcers. So that he feels it's primarily because of this. And then even today, then he says, even today, whenever have this pain in stomach with this tumor, one symptom that I will always get, this is the only thing that is consistent, that I will have excessive salivation and I will have ulcerations in mouth. And I think, why am I having ulceration along with this? So that tells me that the mononucleosis has not gotten healed, and that has now sort of evolved itself into the pancreatic tumor. So I gave a remedy for his mononucleosis, for the ulceration in mouth. In fact, I gave him mercury, after which now he is doing much better. These mouth ulcers are better and he has not had any pain. It's almost 2 months now. Actually, today morning only he emailed me. After 2 months, first time he has had pain. Otherwise, he used to have it almost every week.
Gosh, okay, that's quite a big difference already then, just with
Yeah.
the salt.
So the point of narrating this case was that tracing the deeper disease,
Mm-hmm, mm-hmm.
the underlying disease which you feel is just there, it's not important, I had it in childhood, this is just a mouth ulcer, what is there, once in 3 4 months I have this ulcer, that's not at all an issue. That patients need to understand that that inherent slow grade symptoms that you are having are actually the real causes of your chronic disease. Those, you have become so used to those symptoms that
Yes.
you're feeling they are not important. but they are the most important ones.
Yes, absolutely. And of course, the build-up of those, you keep ignoring those, then something deeper is going to happen, isn't it?
Yeah. Because this patient is feeling, I've just some excessive salivation, little bit ulceration. What is there? This is not an issue. For me, the tumor is the issue.
Yes, yes, exactly. But in order to treat that, we need to get everything else right.
Yes, you need to treat the root from where it began.
And we don't talk about this very much, obviously, with our home prescribing audience. Primarily the people who we're talking to openly about using homeopathy at home, we talk about treating the symptoms and acute prescribing. And very often we're not talking about actually how deep homeopathy is and how homeopathy is used to address not only chronic symptoms now and chronic disease, but also we're looking at strengthening that inherited susceptibility and the genetics as well.
Yeah. And it is actually the real cause of disease. What Hahnemann said is miasmatic disease. And miasmatic disease means genetic disease. In today's term, we can say
Genetics.
that is genetics. So actually, we want to treat the genetic because that is the main root, and that is what is in Hahnemann words, he says that is what causes hydra-headed diseases. Means that genetic disposition will create multiple pathologies, ulcerations, tumors, diabetes, blood pressure. All these for us are the hydra heads. But the real root of all these hydra heads is in the genetic predisposition. If you hit that, all the hydra heads will fall down. You don't need to treat everything separately. Having this approach of trying to treat every single sort of diagnosis or every single symptom with a different remedy is not the true potential of homeopathy. You are using it in a very superficial manner. You'll get relief, but the real benefit of homeopathy is cure. You should not have symptoms today, you should not have it tomorrow also. That's the main thing of homeopathy. But if you try to address only symptom, you are only going to have symptoms only relief only for today.
So what you're actually saying is we don't really need to be peeling away the onion. We can just go straight for the heart as it is. We can go
Yes.
straight to the center and then everything else will fall apart.
Correct.
Brilliant. Brilliant. That's really what
That's the main message, actually. Good, you summarized it well.
yeah,
That's the main message.
yeah,
That why that buttermilk was important is
yeah.
because if I kept treating the chilies, it would have ameliorated. But the buttermilk, everything goes.
Everything falls apart.
Hmm.
So this has opened up a real conversation for us now, hasn't it?
Yeah.
To experiment with this. So Shrikant, it would be fantastic to put together some written cases and so that we can start collecting this information and getting it published because it's really fantastic. And as it happens, I went to a talk yesterday and I heard something about this last week. And so now is the time for this to come out and be published, isn't it?
Yeah, I'm happy. I can write 2 or 3 cases and I can send it with long-term follow-ups, 2, 3 years follow-ups.
Yeah,
I will share it with you.
perfect. Dr. Shrikant Talari, it's been lovely talking to you today. Thank you
Thank
so
you.
much for coming in and sharing your experience.
Thank you, Mary. Thanks for having me. See you. Bye.
I do hope you've enjoyed these episodes and I do hope you can subscribe to our channels. Now, there are various ways for you to listen to our podcast or watch it on video on YouTube. So whether it's iTunes, Spotify or YouTube, please do subscribe and please do leave us a review. If you leave us a review on these platforms, then more people will see our podcast. We just want more people to share the joy of homeopathy. It's a choice that everybody should know about. please do everything you can to help us help more people.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.